have a lot of patients who will present to the office with concerns that they may have a hormone imbalance. Now, that's a little bit more vague term than perimenopause. It could mean a lot of different things and could involve a lot of different hormones or other organ systems or conditions that we don't normally treat as gynecologists. There are other conditions that could mimic the symptoms of perimenopause, or some of them. We need to think about potential thyroid conditions that could occur at this time and are fairly common during this stage of life for women. And it's very simple to draw blood levels to make sure that there are no problems with thyroid abnormalities. It's also important to take that menstrual history and address any issues that might be related to other causes for abnormal bleeding. But as it relates to perimenopause, certainly we could consider perimenopause or the menopause transition as a hormone imbalance. And this imbalance of hormones is occurring relative to previous levels in the woman's life. But like menopause, perimenopause is a part of the natural process and not necessarily a disease that has to be treated. Hormone testing is generally not helpful because there's such extreme fluctuations. You could measure a hormone today, and 2 days from now it could either be half that amount or twice that amount. It's a little different than treating menopause symptoms. Menopause symptoms we're treating by just trying to supplement or replace hormones, but with perimenopause we're dealing with these wide fluctuations in hormone levels, and this roller coaster of hormones are what causes these symptoms. And so oftentimes what will be helpful in that situation is using some sort of a hormonal contraceptive, whether it be a pill or something else, in appropriate candidates, because we're trying to give enough of a hormonal stimulus to suppress the ovary's production of its own hormones to try to level out those fluctuations. And then of course those hormones can also kind of fill in the gaps where those hormone levels might be low. Other medications can be used, non-hormonal medications, for specific symptoms, particularly such as the mood-related issues that we sometimes see. Supplements and some herbal remedies have not been studied well, but are probably safe and may help particularly with milder symptoms. And it's critically important, and I tell all of my patients this, that you need to really focus on healthy diet, regular physical activity, making sure that you're getting adequate sleep with good sleep habits, and focus on mental and psychological health, keeping a good life balance and those sorts of things. And I think this is as critically important as just about anything for helping to cope with moving through this transition of life. Patients who are dealing with perimenopause have lots of resources available to them. Board-certified OBGYNs are certainly trained in the treatment of this condition. There are other providers and clinics out there that are set up to provide hormone treatments, and I'd be a little bit cautious about who you choose to see. There are some treatments out there that might not be well tested clinically, and sometimes insurance won't cover those types of treatments. The North American Menopause Society is a great website, a great resource for information about this and other things related to menopause, and also provides a tool that you can use to find providers in your area that are certified menopause practitioners.